My name is Jason Erickson here at the Alliance for Massage Therapy Education Educational Conference, and I've got Doug Nelson here. And so Doug, tell us a little bit about yourself and your role with the Massage Therapy Foundation and what's coming up.
Cool. Well, I'm happy to be here. I've been a massage therapist this is my 40th year. Amazing. And I have a clinic in Champaign, Illinois that I've had for 35 years with 19 therapists. And so I've been doing this work for a long time. But what's new for me is in the last couple of years being involved with the Massage Therapy Foundation. First as a committee member and then on the board, and now as President-Elect, and I'll take over March of next year. And it's really important, I think, for the foundation to be here. All the stakeholders are here, and one of the things we hear in the conference is the importance of research, how important research is to the educational process, and that's really what the foundation is really all about. Every discipline has a foundation, and ours should be the same. And so in our foundation, we're supposed to be able to serve our constituency, which is massage therapists, by providing educational resources in terms of research. We support grants. We give money to fund research grants. We are educating people in our profession about the importance of research and also how to read research studies, how to understand it, how to glean from that, what that means, with the end goal really of relevance. It has to be relevant to daily practice. Reading research, exploring these things really will change the way you do, how you treat your clients. And I think research in many ways is just formalized learning, and we all learn from seeing our clients. It's what you do, you see the results, and you adapt and you change. It's what we all do. And the most formal way is to do the research thing, but it's not different than what you and I do in the clinic every day. It's just learning, and we learn because it enriches our lives and makes our work richer and deeper, but it also benefits the people who grace our doorways. And what a cool thing, it's good for us, it's good for them. Turns out it's really great for the profession as well. So it's a win-win for everybody.
Fantastic. Thank you very much for your comments. And now, before I let you go though, are there any new developments coming up with the Massage Therapy Foundation that you'd really like people to know about?
Well, I think we have several initiatives that we're working on. And some of those will be announced fairly soon, so I'm not going to do that. But I can tell you one of the major things is, at least for me, is making that research relevant to daily practice for the average therapist. We'll do more and more things that will help the average therapist employ these research ideas into their practice. That's the goal.
Now, there was a lot of discussion about some studies that were done by the Samueli Institute on behalf of the Massage Therapy Foundation.
Yes.
Could you talk a little bit about how those are available?
Yes.
But then also how they're relevant?
Yeah. Well, there were 3 different studies, one on, all of them having to do with pain, surgical pain, chronic pain. And again, all those research studies can be accessed, open access, and you can read those studies. And what we're hoping to do is create a whole bunch of infographics so that people can glean from that how they might employ that in their daily practice. It was a huge endeavor done with the foundation, with the American Massage Therapy Association, the AFMTE, and also the Samueli Institute. And really looking at all these different studies and what to take from that. It was an enormous project and got an enormous amount of press. I think there were 1 million downloads of the press release. Wow. Just wow. So it got a lot of notice, not just obviously from people in our profession, but other healthcare professions as well. People take notice. This is a good thing.
Awesome. Well, thank you very much for all the work that you and the Massage Therapy Foundation are doing for us.
It's our pleasure. It's our pleasure. We're here to serve.